Another type of cyanotic defect is the transposition of the great arteries. This is when the position of the pulmonary artery and the aorta are reversed. So you can see in the picture that the aorta is supposed to be connected to the left ventricle, but instead it's connected to the right ventricle. And the pulmonary artery, which is supposed to be connected to the right ventricle, is connected to the left ventricle. Usually there is another type of opening between the right and the left side, so like an atrial septal defect or a ventricular septal defect. But most of the blood returning to the heart is pumped back out without going to the lungs for oxygen. This is usually diagnosed shortly after birth or even prenatally because it can cause lots of problems for the newborn. Some of the symptoms are cyanosis, so a blue coloring of the skin, shortness of breath, lack of appetite, a poor weight gain, as well as other symptoms. The causes are mostly unknown but can also be caused by a viral illness like rubella during pregnancy, or if your mother is over 40 years old or has uncontrolled diabetes. Some of the risk factors of having this defect are rubella during pregnancy, poor nutrition during pregnancy, mother older than 40 years old, a mother with poorly controlled diabetes, or if the baby has Down syndrome. Some of the complications that can occur with this defect are lack of oxygen to the tissues, which is called hypoxia, heart failure, lung damage, and others. Some of the complications that can occur after surgery are narrowing of the coronary arteries, which supply blood to the heart, heart rhythm abnormalities, heart muscle weakness or stiffness, and leaky heart valves. Some of the treatment methods for transposition of the great arteries is using medication. For example, prostaglandin E1, which keeps the ductus arteriosus open, so it increases the blood flow, keeps your baby alive. But usually this would be before a surgery because you would have to have a surgery to fix the problem. Another type of treatment is atrial septostomy, which enlarges the natural hole between the two atria so the blood can mix until surgery. Usually you wouldn't want this to happen, but without blood mixing, your baby's body wouldn't be able to receive the oxygen and nutrients it needs. Another type of treatment is the arterial switch operation, which reattaches the arteries to the proper ventricle. So the pulmonary artery would be connected again to the right ventricle, and the aorta would be connected to the left ventricle again. And then the coronary arteries would reattach to the aorta. So you can see here that before the aorta was connected to the right side and the pulmonary artery was connected to the left side. But at the end, the pulmonary artery is on the right and the aorta is on the left. Another type of treatment is the atrial switch operation, which creates a tunnel between the heart's atria and diverts oxygen-poor blood to the left ventricle and the pulmonary artery. This also causes oxygen-rich blood to flow towards the right ventricle and the aorta. So instead of having the right ventricle pump to the lungs and the left ventricle pump to the body, the right ventricle will now pump blood to the body instead of just to the lungs.